Welcome. My name is Peter Strong, and I am a professional psychotherapist specializing in mindfulness therapy for the treatment of anxiety and depression, and also for help with PTSD. The particular method that I've developed over the years and found to be extremely effective for helping people recover from emotional or psychological trauma is called Mindfulness-based Imagery Reprocessing. So this is part of mindfulness therapy. What is mindfulness, first of all? Well, mindfulness simply refers to a form of conscious awareness which is not reactive. So we're able to be fully present with whatever we're focusing on without reacting either emotionally or cognitively or judging it or even labeling the object. We don't talk about it. We simply observe it with full conscious presence. So that's a characteristic of mindfulness, and it's extremely important for many things, but particularly for recovery from emotional suffering, including emotional trauma in PTSD. So when we apply mindfulness to emotional trauma, we are actually talking about developing this quality of full conscious awareness of our traumatic memories, and particularly the imagery of those memories, the pictures that we form in our mind that generate the emotional trauma that can go on for many years after the event. So the primary cause of emotional suffering is to be found in that imagery itself. The imagery has certain properties which cause it to trigger emotional pain. For example, its size. Intense emotional experiences tend to be very large in size. That's how we see them in the mind. Emotional experiences that have a very low intensity, that don't affect us, typically are very small in size. The position of the image is also very important. So it's makes sense when you think about how we usually talk about emotional experience as being overpowering or overwhelming. This kind of language is referring to the emotion and its position, how we see that in the mind. So typically, again, overwhelming emotions, such as emotional trauma, are seen at a high position in our psychological field of vision, how we see things internally. They tend to be at a high level above us. That's why we use language like we feel overwhelmed. Literally, the image is over us. And typically, when an emotion is not overwhelming, when it's neutral or has little effect on us, then the imagery will reflect that, and typically that imagery will be at a lower level in our psychological field. So when we are feeling very good and happy, in a state of emotional well-being, typically we might say, I feel on top of things now, I feel on top of the world. This language is a clue that points to the internal psychological imagery of the emotion. Other factors we look at are the color of the image. So again, intense traumatic images typically are seen in great detail, great color, is one of those features of the details of the imagery, the color. And when memories become faded, that color becomes a little more muted, less intense in color. So color is another feature that is part of the structure of traumatic imagery. The color is a factor that creates the emotional trauma. Other factors may include how close the image is. That's related to its size. So typically intense images are very close in our visual field, and less intense memories tend to be further away in our internal psychological field of vision. There are many other factors. How hot or cold the imagery is, how hard or soft it is, and many other properties like that that are basically visual in nature. So, when we are examining our traumatic imagery and memories with mindfulness, we are learning to explore this imagery without reacting to it. We're learning to see the details of how that imagery actually works, how it creates the emotion, the structure of it. So if it's very large, we would want to try and reprocess that imagery and make it very small. If we see it at a high level in our visual field, we might want to try and move it to a lower level. If it's too close, we might want to move it further away. So we can effectively change the imagery of our memories and change them in a way that leads to the resolution of that emotional pain. So this method is very effective, mindfulness-based imagery processing. We're really taking consciousness and exploring how to change that imagery in a way that leads to healing. Now, this would normally happen by itself. Memories do become smaller, more distant, and faded over time. But with highly intense traumatic imagery, this process of reprocessing, of digestion, of change doesn't happen. And typically that imagery remains stuck in its original form, and whenever the imagery is triggered by events or thoughts or any other external triggers, then what happens is that imagery is reconstructed in the mind in its original form. So the real problem with PTSD is that imagery has not processed properly and has not resolved. So in mindfulness therapy, we work on completing that process of resolution of the imagery. We help it change. We help it, if you like, learn how to change itself, how to move in a direction of change that leads to the resolution of that emotional pain, so that the memory becomes like any other memory, typically quite neutral and not traumatic in nature. It's important to understand this. The It's the structure of the imagery that causes the emotional trauma, not the event itself. That's not the cause. That's a trigger that caused that imagery to form, but it's because that imagery became stuck and did not process itself to resolution. That is the cause of the trauma. So if you're interested in learning more about how to work with your emotional trauma or other traumatic memories that you're struggling with, including intrusive memories, then please contact me and tell me more about your particular condition, your needs, and then I will explain to you more about how we can work with that using mindfulness. And when you feel ready, we can schedule a therapy session via Skype. So mindfulness-based imagery processing is part of the mindfulness therapy approach that I teach online. It's a very important part. There are other aspects as well. So if you'd like to learn more, please contact me. Thank you.